coming today. I'm Robin Kohler. I am the secretary for the Vernon Community Network. So nice to see so many people here. Thanks so much. We're going to start off with our president, Terry Lynn Rogers, giving us a little update.
Hi, I'm Terry Rogers, president of the Vernon Community Network. I also sit on the Human Services Commission here in town, as well as a member of the town council.
But we really wanted just to move into our speaker, give them enough time to present to us and question and answers before folks have to leave. So let me introduce to you Donna Cameron. She's the Administrative Director of Oncology and Women's Services at ECHN. And she brought with her today Georgianne Torres, who is the Community Health Navigator. Feel free to tell us more about yourself and about the programs that you're looking to share with us today.
Good morning. Thank you so much for allowing Georgianne and I to be here this morning. My name is Donna Cameron. As Robin so kindly introduced us, I am the Director of Oncology and Women's Services for ECHN. I am a nurse. Foremost and foremost, I am a nurse and I will always be a nurse. So everything I do, things from that nursing background. So women's health is a big passion of mine. Georgianne's going to get into the program that we have, but we have a early detection program through the CDC and the DPH, and Georgianne will give you a little bit more details about it. But I'm here today because I touched base with Terry and I said, Terry, can you help me on out? We can't give away this program. This program is free, totally free. Women will get services totally free. And we're having trouble getting women to come in and get services. So why do you think women won't come? Fear. Fear is huge, yeah.
Another one could be some people are undocumented and they're scared to come. So do you guys take undocumented people as well?
Yes, we actually, good morning, my name is Georgianne Torres. I'm the community health worker, navigator. And yes, that's one of our most, I would say 80% of the patients we see are undocumented. Okay. We are a safe place for them, no questions asked, besides a enrollment questionnaire, but it's generic, basic to nothing. And whenever they come in, they'll make an appointment with Edri. She's our co-worker, another team member. Edri will explain the program to them. She would let them know if they qualified or not right there and then when they call her. She'll go through everything we cover thoroughly, any questions, any concerns. She'll get them ready for their appointment. And then when they come in, they'll meet with me. I'm in charge of the early detection wise women program. Wise women being, they come in, they'll have their blood work done to verify glucose and cholesterol. They'll come in, they'll see the doctor for a breast exam and a pelvic if they need it, or a Pap. It all depends on the doctor. And many of them do have fear. They're undocumented, they have no one here. Most of them are working under the table, and we are, like I said, a safe haven for them.
So follow-up question or statement to that is, so this person is undocumented, so they have breast cancer. Now treatment costs money. So how's that going to work?
What we're here for.
That is a barrier, but we do find ways to work on that barrier there, because it is tough when somebody is totally undocumented and we can't get them any kind of assistance at all. But we've got tricks of the trade. This program is throughout the whole entire state, so we reach out to the state. It is funded by the DPH, our Connecticut DPH, and the CDC. And again, people when they hear, oh, you're funded by the state and a national, so all my stuff's going to go to them, right? Data is inputted into a system because the CDC needs to know, is my money being well spent?
Yeah.
Is the DPH needs to know, is this working? You know, if this isn't working, then we need to change things around. Everything that goes into the systems that anybody will see is totally de-identified. So there's no names involved in that. The only ones that are going to know names or Jan, myself, and Edri, who is our health system navigator who enrolls people. So everything is totally de-identified. And when they call Edri to enroll in the program, we don't even ask them for proof of income. It's quick questions over the phone. It's 250% of the poverty level. How many people in your family? What's your weekly income? Monthly income, yearly income? Okay, we look at the chart, you're covered, let's get you going.
We're currently working with, so I do a lot of outreach out in the community, and part of my job is to sell this to, I don't know how else to say it. And we've made several connections with, we work with, I don't know if you guys heard of Malta House. They're a program based out of Hartford, and they see people that don't have insurance. They do have to pay, they have a scale, but it's like really, they will work with the patients at this point in time. Right now, well, they do come to East Hartford, but right now their van is out of commission because the heat is not working, but they're still seeing patients in Hartford. That's a big connection that we have. We work with, what else? The Manchester schools, work closely with the social workers. They'll refer some people to us. Also, the church, Peaches. Peaches. We work closely with Peaches, yes, several years now. They're great, they're always a great connection. Also the food pantry down the street, we just had a patient actually that saw our information at the food pantry. So yeah, we can't stress enough that breast health is so extremely important for women. And as women, as women, we tend to focus a lot on the family and our job and the day-to-day, and we sometimes forget about us and just taking care of ourselves sometimes. But like I said, we can't stress enough that healthcare for women is so important. I don't know if you guys heard of the CNN reporter that was just diagnosed. She made very touching. I feel like I'm in this line of work. Healthcare has been my passion always throughout my career. So yeah, we just want to help as many women as we can. Yes.
Do women have to be at risk in any type of way or be suspecting or anything with history to go, or it's just available for all women to be screened?
So women can come in as young as 21 even to get that Pap smear done. If they don't want to go somewhere, they will get a Pap smear if they're due for one, and HPV testing, which is so very important. So we do the dual testing for that, not just the Pap smear. We're also looking for the HPV virus. And you may know that HPV virus is something, if it's there and one of the variants there, it could lead to cervical cancer down the road. So we are going to test for that. Again, totally paid for by the grant. A woman of that age is not going to qualify for a mammogram. They're too young to have that done. But if something happens on a clinical breast exam and they notice a lump or something, the grant will pay for them to get a breast ultrasound done. So we're going to make sure that that woman is all tucked in. You know, any woman who needs services, they can always just call that number. Georgianne has information there. We have a coupon there, information on one side is English, the other side is Spanish. So there's a number that they can just call and ask for information. You know, we have seen women that live in Hartford, they want to come see us, they can come see us. You know, we're not that territorial. We just want to make sure women get the services that they need. So one quick thing too is the Affordable Care Act came in. Our numbers were booming. We had women coming out of the woodwork to get services because this was totally free and it's a program for women who are uninsured. Then the Affordable Care Act came in, which was wonderful. All these women now got insurance. But then they got insurance and they said, okay, I've got my screening mammogram done. I have to come back and get another mammogram done. Okay, let's see, I gotta pay rent, I gotta pay food. I now have to pay for my insurance. This diagnostic exam is going to go towards my deductible. I can't pay for that. I'm not gonna do it. So a bunch of us went to the state and we said, you gotta help us on out here. We're losing people who desperately need that diagnostic exam. What can you do for us? So they changed the parameters and said, even if you have insurance, your deductible, maybe you've got as low a deductible or a higher deductible as $1,000. As long as you meet that eligibility requirement, that income eligibility requirement, even though you have insurance, we'll get you on in, we'll pay for that diagnostic exam. If that diagnostic exam then leads to, well, you've got something there, we're not quite sure, you need to have a breast biopsy done, we need to name what's going on in your breast, we're gonna cover that too. So that first time that you get covered and qualify for the program, all these different things are gonna get covered for you. Okay, so it's not just for those that are uninsured, we'll also take care of the underinsured, in a sense, those that have insurance but need help.
And what's the length of time that you stay with someone? Is it just depending on the individual.
We've had women that have been in the program until they get to be 64 years old,
Yes.
in all honesty. You know, we are their peeps. You know, we do have to requalify them every year, but we're their peeps.
So you said up to 65. Is there an age cutoff for this program?
It is 64, but I think if there's something with your Medicare and one of the, Edry knows, for example, too.
Yes.
So I always tell somebody, even over the age of 64, to still call, because there has to be some of those Medicare, and I don't know if they've changed anything, the Part Bs and elemental Ps and all those different parts to the Medicare system. Edry has all that info. She's our health systems navigator. She knows all that, the statistics and all those stuff there, and insurance stuff. And if she doesn't have an answer, she calls to the state to find out what we can do to help someone.
So clients are coming to Manchester Hospital?
Right now, we see patients over at Hartford Road, 130 Hartford Road, to see the doctor side of the appointment. We also see people here at the hospital in Vernon for patients. That's what we have right now. We used to have Waterbury. We're kind of in the works.
Yeah. Nobody here is going to be going down to Waterbury, but we've got Waterbury. And we're working to try to network with Planned Parenthood, too.
You said 130 Hartford Road, what town?
In Manchester.
Manchester.
Oh, there's a, okay.
Yeah, so we see patients Manchester and Vernon. For the mammogram, they can either come here, Manchester, or over at the Women's Center. Even Talent we use for imaging.
So the fear piece of it is the biggest thing, too. So, you know, and we get that, you know. Our providers that do the services are great. Georgianne is bilingual. You know, we do our best to make everybody feel comfortable. You know, we have, for women who do not speak English and Georgianne cannot translate for them, we get services, so interpreter services. You know, we try to make this as easy as possible. When we say we're going to follow them through, they have a screening mammogram, something comes up, we do that diagnostic exam, we'll get that biopsy done if it needs be. For a woman who is a citizen of the United States, if they are diagnosed with breast cancer, we then can get them hooked up to what's called breast and cervical Medicaid, so they would be covered. Their services for cancer care would be totally covered. All of our providers in the system, many of our providers in the system do help out in regards to seeing our patients. Over at Rockville, we have providers that are there that have been doing this for years. You know, they know our women. So fear is the biggest.
I have a question. I might have said something, but what about care after the diagnosis, after the treatment service? What do you have anything associated with that?
Yes, so after they're diagnosed, we do have, ECHN has a cancer center right across the street from Manchester Hospital. We're able to provide radiation oncology, chemotherapy, all in that same building. And we have navigators. We have two nurses who are navigators, and we have an oncology social worker. Their services are totally free. We do not bill for their services. So when a woman comes in for breast imaging, the navigation piece of it starts there. So it goes from Georgianne, who starts to navigate that woman, and maybe they come and get their breast imaging done, and they need more services. They'll then be contacted by Amy Janofsky, who's our patient care navigator that works with all of our breast patients, to help them get scheduled for biopsies, help them to get scheduled for a surgical consult. So we have a safety net for all these women. It's kind of like that old Verizon commercial that used to be out there where the guy is standing there next to the customer and behind him is all those people. But there's only one person standing next to him, you know, the guy that's trying to sell you your Verizon network there is standing next to you. But we're kind of like that. We're not going to sell you anything, but what we're going to do for you is we're all going to be behind you, Georgianne, Edry, myself, Amy, you know, the other navigators, our physicians, our radiologists, pathologists, all those people. You've got peeps behind you. And when you need that person, they're going to be standing right next to you. When you don't need them to hold your hand or help to empower you, and that's another goal of our program, we're trying to help these women to be able to advocate for themselves.
Right before, I think it was right after COVID, when we started kind of getting back to our normal. We had a patient, she was from Ecuador. She was here only for 6 months of the year. She came in for her appointment. They found something that she needed a biopsy. She was very nervous, didn't know, oh my God, my husband's back home in Ecuador, or my kids are there. I just came 6 months here to get literally a mammogram, Pap, all that medical stuff that in her country is kind of almost near impossible to get. She needed a biopsy, like I said. we all, Edry, myself, Donna, we held her hand. The biopsy day came. I couldn't be in the room with her, but I was right outside. I was there when she got there for her appointment over at our location at the Women's Center. I was there when she got there for her appointment. I reassuring her everything's gonna be okay. She spoke Spanish, so she was very grateful and happy I was there. Went through her procedure, her appointment came, she went home, and still to this day, it's probably been like 3 years, she's back home, and every now and then, I would get a call from her. Because she's so grateful that we just helped her out. And through her, I believe through her, we got like 3 more ladies came in just because she spoke about her experience with us, so. That's what we're here to do. We try.
I have to say, I mean, anybody who's in the room who's ever had that experience where you go for your mammogram and then you get that call, you know, we need to see you again, and everybody's like, oh, you know, you go into panic mode, you think the worst, so knowing that there's a support system is
Yes.
wonderful. What's your funding period? I mean, is it like a 3-year grant and then it's going to end?
We have 5, we
5 years.
usually 3 to 5 years. So we just started our new grant cycle, and we've had it since
Yes.
when?
95.
1995.
Wow, that shows what great work you're doing. That's great.
Yes.
So just another quick example, Georgianne told you about the woman from Ecuador. I've just recently navigated 2 women who were diagnosed with breast cancer. The first thing they said to me was, you know, I'm feeling great. I'm so busy at work. I got stuff going on with the kids at home and my family. I was going to skip that screening mammogram. If she had skipped that screening mammogram and waited for another year, her breast cancer would probably have been at a later stage and more invasive. So don't skip them.
Do you offer any kind of education services or other resources related to women's health that you're able to share?
Yeah. Between Georgianne's card and my card,
Yes.
we love to take the show on the road, because the more that we can get there, you know, in regards to letting women know how important it is to, you gotta know your body, you gotta know your girls, you know, you've gotta know what's your norm for you. Because don't depend upon your doctor when you go see your doctor every year. Think of how many people your doctor is seeing. You are special, but to them, you're one of how many?
A few years ago, I have connections with MCC, the Manchester College, Community College, and we had a son see our brochures on display on their bulletin board thing. And his mom was a farm worker over in a farm in Willimantic, and she had no health insurance. It's been over 12 years since she had a Pap and a mammogram. So he saw our information and he called, made an appointment for his mom. He came with her into the appointment, a bit embarrassed because of course it's like, oh, that's my mom. But again, very grateful that we offer the services. Like I said, he came, he waited out in the waiting room for her, and was just grateful overall.
So we could talk forever about this.
Yes.
The program cover the caregiver support as well, like educating them on how to be supportive while you guys working?
That's a great question.
That is a great question. So when you come in as a family, you know, it's a team, like Georgianne,
Yes.
you helped that son to understand what was going on and stuff, right?
Yes, and even once we called her for her blood work results and whatnot, he had questions like, okay, is that within the normal parameters? Does she have to do anything about this? So we offered him the peace he needed at the moment, because to begin with, he was already worried about his mom, and just us explaining everything to him clearly, step by step. It was in Spanish, so that was a plus.
But yes, we will, you know, and especially if somebody is diagnosed with cancer, we're there to help, you know, between the team here, but especially the navigation team over at the Cancer Center, and especially of our oncology social worker. we know that when somebody's diagnosed with cancer, it's not just that person, it impacts the whole entire family. You know, and especially men, sometimes they don't know what to do with this. Or children, how do I tell my kids and stuff? So, you know, we work with the whole entire family. It's a family unit.
So thank you, ladies, for helping me get a better understanding. My question for you guys, like out of all the things you could be doing in the world, all of those different opportunities out here, like what drives you so passionately to do this for women?
You wanna go first?
I actually went to school for nursing. I'm a bachelor's in nursing. I went to nursing school in Puerto Rico. So like I said, all through my career, well, I was like 16. I used to work at Dunkin' Donuts, but that's about it. Other than that, it's always been in the healthcare, whether it's front desk, check in, check out, surgical coordinator, yeah, you name it, I've done it.
Wow.
And now I'm here, and I could honestly say, not because Donald's here, but I love what I do. This is amazing, and I came in, it'll be 5 years this year, actually. And I love what I do. Helping women is just, especially when somebody comes in and they're lost, they don't understand, and you can help them like come to the light, basically.
Yeah.
That's just, yeah.
Thank you.
I mean, for me, it's, both of my parents are Portuguese, and my grandmother lived with us, my maternal grandmother lived with us for years, and English was definitely not her first language. And just seeing she was treated very well many times when she went to healthcare, but, you know, people thought that she wasn't very smart or didn't understand because she didn't speak the language. So that was an early thing, and then my grandmother was diagnosed with breast cancer. And then many years later, my mom was diagnosed, and I was already a nurse by the time my mom was diagnosed. But just seeing what was happening with them, and they got great care, but it's like, there's gotta be a better way to do this. There's gotta be a better way to do this. So that's always been my passion, is how can we make this better? Don't stand on where we are now. There's gotta be better ways. And what do you see as ways that we can improve these things here? Because it's not our program, it's our program on how we can help people.
So, I know you talked about your grandmother and your mom and stuff, but what if, for instance, like I had breast cancer, and so I wanted to do, which I did, a test that, you know, would say, you know, will my kids have it later on, and obviously, thank God, no. But what about your program? Do you guys offer that to people as well?
We're working with that with the state. It's kind of sometimes on a case-by-case basis. We haven't had them be able to pay for it yet. But with that said, there's always other ways, because there's other avenues that I sometimes can look into to say, how can you help a lady? The nice thing with the genetic testing is now too is, there was one company that had the patent for it for years, and their patent ran out, and now all these other different companies are coming, and I just found out the other day that there's a company that charges, I think they charge like $249, but if the woman can't pay for that, they have an assistance program, and if they find out she is diagnosed with breast cancer, or she has breast cancer, when they do the genetic testing, the test is free. So a lot of these companies now will work with families to figure out how to make sure they get that information. But you bring up a great point, because if a woman is BRCA positive, it's not just, oh, I've got daughters. Breast cancer can also be, sons can also be at risk for breast cancer too.
Is like, historically, is like the rate seeming to increase, stay about the same, decrease?
It's a really good question. It's kind of all over the place in regards to the incidence of breast cancer is still pretty up there. 1 in 8 women will get breast cancer. But the good thing is that women are doing better about getting those screening mammograms done. So even if a woman is diagnosed with breast cancer, many times I'm working with women in between Georgianne and I, women who are diagnosed at an early stage of breast cancer and so easily treated.
Yeah.
So yes, there might be, I think there's like over 4 million survivors of breast cancer, I think, in the United States right now, and that number is growing. Which brings me to another thing, there should be no secrets in families. You know, families should know what's going on, you know, there should be no secrets. Thanksgiving has kind of been designated as the day you're sitting around table enjoying pie, you know, talk about the family history. what's going on in our family, because there should never be any, any secrets. There is a small, when women are diagnosed with breast cancer, there's only a small piece of the pie that's either genetic or familiar because it runs in the family. The biggest piece of the pie is we don't know what happened.
Just so I understand the program, I understand as far as getting diagnosed, as far as treatments, but again, after the treatment, is there resources for survivors for like therapy? I'm a 2-time cancer survivor. So there is a lot of things that I have questions about, but I don't know who to go to. So as a person in your group or in your program, would you cover those resources? Or
Because-
be able to direct a person to?
Right, because then what we would do is, many people when they're diagnosed with cancer will get something that's called a survivorship care plan. And that survivorship care plan is kind of like, I hate to use the word care plan, I call it your wellness plan moving forward. It's supposed to give you information in regards to what chemotherapy drugs you got if you had it, what radiation treatment you had, what surgery you had, what was your diagnosis, all those different things. That's what happens during treatment. What they should be doing then is saying to you, okay, we want to make sure that you get this, you need to check these boxes every year. You need to make sure you get this done. Get your mammo done, get this done. Maybe you need a bone density done. Maybe you need this done. Maybe you need that done. If you didn't get that, I would say you could reach out to where you got care. If you got care at ECHN, I'm going to give you my card. You let me know and we'll find out, we'll get you information. At ECHN, we're totally working on revamping our whole survivorship program. So we're starting to do some things here, and I'll leave some of my cards out there too, is we're trying to reboot, revamp, whatever you want to call it, our survivorship program at ECHN. Breast is probably the top diagnosis that we have at ECHN, followed closely by prostate. But we want to make sure that we're developing a survivorship program that's based on the needs of the survivors. Because we do our survivorship day at ECHN, and I meet people that are 30-year survivors. Usually it's breast cancer. One woman was 35 last time I met her. It's been 35 years since last she was diagnosed with breast cancer. So we want to make sure we're creating a program that works for you. What is it that you need? What do you want us to do here? So we're starting to blow up, revamp, reboot our whole survivorship program. So I will leave, I think I've got a good amount of cards out there, but if not, we'll make sure you get our information here. I want your ideas.
How often do you recommend for a woman to go get the screening or scan or go get checked for pap smears?
Every woman should do it yearly, clockwork, unless otherwise, like Peaches mentioned, she used to go 3 months, 6 months. Unless otherwise indicated, every year a woman should schedule that appointment, no ifs, ands, or buts.
So the bottom line is try to eat healthy.
Yes.
Drink a lot of water, get some exercise, get some vitamin D, when the sun eventually decides to come out. But, try to maintain those things that I'm sure they tell you every year when you go to the doctor. Are you drinking your water? Are you getting exercise? Are you doing this? Are you watching that? Do the best that you can, because that's good for your body, not only, for any type of cancer, but, like we said, more women die of heart disease than they do with breast cancer.
For my last question, is there a true cancer screening after implants? Like, can you get a true reading if you have implants?
They can displace the implants for women that have implants, but usually many times what they do is it's on a kind of case-by-case basis. Some women will just have an ultrasound done, depending on how much breast tissue is still there.
Thank you so much.
Thank you so much.